tip number 4, use a standard format every time whenever you give a report. And what I mean by a standard format is I can't tell you how many times I have been given a report and it's like, this is this patient, here's their history, their AO times 4, they have a 21 gauge in their right AC, they have a normal saline running at 125. Oh, did I tell you about that sore on their butt? And it was like jumbling all over the place, guys. I can't even tell you how much it was jumbled. But what I mean by standard is make sure that you're like going in order. Like make sure you have what I call like an S-bar sheet. So, and I'm going to show you some examples. So you can have something like an S-bar shift report sheet, which is just like this one. And I'm going to make sure this is downloadable so you guys can have this as well. But this is super helpful. So if this is something you want to fill out, and then it's super easy, you can just go down this sheet and talk to your nurse about it. And this gives you the whole situation, the background of the patient, the assessment that you were given of this patient, recommendations, if there was any tests that need to be done, any labs that need to be done, any medications that need to be given at any certain time. It's just very organized, right? So there are going to be people, have like an S-bar sheet, or you're going to have people that have like legit report sheets. And so personally, I used a report sheet. That was this one right here. So I'm showing it on the screen. And again, I will have this in the lower comments that you guys can download online. But this was my report sheet, and this was very standardized for me. So pretty much it was, I went down the line and I just had the doctor's information, patient's diet information, if they were a full code, what they were there for, the neuro, and then it just literally went from like body system down, right? So it just went blah, 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 all the way down. And you want it to be like that. You don't want to be someone that's going to be jumping from like one body system to then, oh, they have a history of asthma, or, oh, they had, a 22 cc of that, or a 22 gauge that they ripped out. Now they have a 21. Oh crap. Well, which arm was it? And like, it's just like, I've had nurses that have gone literally back and forth about everything. So I want to make sure that when you give a report, make sure it's very fluid. Make sure it's very from the very top of just, here's the patient, here's when they were admitted, here is their history, here is, the body system, go from like the top down, and any labs that need to be done. And then obviously anything that needs to be done on the next shift, make sure you let them aware of that. But please be organized with this and make sure that you write it all out, organize yourself. So that you're not one of those nurses that's like all over the place, because nothing's worse when you just already feel disorganized when you listen to a report, because that nurse is like bouncing from every different direction of information and you're trying to follow, but it's just not like connecting. So it's really good to just have a standardized sheet like this S-bar sheet or that report sheet that I showed you guys. It's super helpful because you can literally just read it from down on for all the information that you need for a patient. So find yourself something that you like. I know for some people, it's trying different ones, trying different things to see what you like, what you don't like. Try different other people's report sheets, see if that works for you until you find something that like clicks, that you really like, it fits your flow, all that stuff. So just make sure you find something that works for you, that makes it easy to follow when you give a report, okay? So that's my tip number 4. It's just making sure you have something standard. So like any of those sheets, okay? Hey everyone, if you enjoyed watching that clip and you want to see the full video to it, make sure you guys click the box here. If you enjoy watching these kind of videos and you want to see more videos from the Nurse Kristen YouTube for pre-nursing, nursing student, new grad nurses, make sure you guys hit the subscribe button over here.